KMPDU chairperson. Thank you so much for making time for us this evening, Turanira. What's your question to Colonel Cyrus Oguna?
Thank you very much, Trevor. So I'll tell Colonel that you are doing an amazing job. Can you hear me?
Yes.
Thank you.
Yes.
Okay. So my concerns were two. The first concern is we are allowing food to be transported across the places where the demarcation, but we cannot allow healthcare workers to pass there. So I'm concerned, in as much as food is important, healthcare workers are also very important. The second thing that I'm concerned about is the issue of healthcare workers. The government's concern is just to thank them. Tell them you're doing an amazing job. We are thanking the healthcare workers for what they're doing. But today, from a notice that we found, is that musicians, I'm not disrespecting them, have gotten a 2 billion shillings for compensation on the kind of work they've been doing. What is being done for healthcare workers? The last concern is Ghana, as a country, has done an amazing job to healthcare workers. They have waived taxes for healthcare workers. They have sorted basic salaries for healthcare workers. They have improved the medical cover for healthcare workers. They have even come up with a COVID allowance for healthcare workers. I am concerned as a country. The only thing the government is doing is thanking healthcare workers. What have you done? And the last concern would be, Colonel Oguna, medical questions should get a medical answer.
All right.
Please, if the answer you're not comfortable answering a question can be defied. Thank you very much, Trevor.
Thanks, Turanira. That's Turanira Gaugushria, KMPDU chairperson. Colonel, did you hear him? His first question is, why are we allowing food transport?
I heard him.
Okay.
Yes, I did hear him. Honestly, our healthcare workers are our first line of defense.
Yeah.
And they're doing an amazing job, no doubt about that. Because without them, really, we would be in a very, very bad place. And therefore, I think for every country, the healthcare workers are like, soldiers in the field. They're the ones who will be facing, the first bullet. And therefore, they are people that we must take good care of, not just in terms of equipping them, but also in terms of enhancing their capacity as far as training is concerned. With regard to, equipping them, indeed, like we did mention earlier, that we initially, faced a challenge because of acquiring protective equipment because of disruption of supply chains. But now we are manufacturing this equipment locally, and therefore we're in a much, much better place than where we were at the beginning. Now, with regard to providing them tax relief as individuals, the head of state did provide tax relief across board, even though they are doing an amazing job. But there are also other Kenyans who are contributing in different ways. So everyone really is doing their role, so doing their part. So when we combine this part, then we get the whole. And therefore, it's not necessary to suggest that other people are not as important. But indeed, healthcare workers are our first line of defense, and therefore they must be taken care of appropriately. And the government is conscious of that. The government is putting them, their issues are a top priority, and as far as the provision of equipment and training is concerned. The other issue that he did mention is about comparison or between people and food. Honestly, we have to be a bit rational about this, that food is for the benefit of all of us. And if you have to protect our people, really, first of all, you must provide them with food. But number two is that you must be able to limit movement, because it is movement through people and contact between people that this virus is actually transmitted. And therefore, it would be a bit not wise on our part to be able to limit movement into any country or movement of food, foodstuffs, because we need food. Even if you're fighting disease, we need to eat in order to be able to fight that disease. But in terms of curtailing movement, that has to be done in order so that we ensure that this disease does not move from one county to another county.
All right, let's bring up another question for Kano.
Good evening, Trevor. Let me ask Mr. Guna, does it mean that if someone has a child or a patient who was admitted within any of the hospitals in Nairobi and is due for discharge either today or tomorrow, the patient will have to remain in the hospital for the next 21 days, and at whose cost?
Kano?
Let me put it this way, really, and it's a question that I've answered and answered it again, that we will not open a window, because if you open one window, you might just open all the doors, all right? Everybody will have an excuse or another. If you have a patient who is being discharged tomorrow, it is unfortunate that tomorrow is already within the 21-day restriction period. And that patient, if it is your patient, then you'll have to make arrangement for that patient. Really, there is no turning back on this. Like I did mention, this is not for the benefit of 2 people or 3 people. It is for the benefit of 47 million Kenyans. And every Kenyan's life is important, really. And therefore, if we can be able, you know, as a people to understand this, it will be much, much more easier for us even to be the ones to be able to enforce it, as opposed to looking at the government and blaming government about this and that. Let's take this as our responsibility as a people. This is for the benefit of this country, for the benefit of 47 million Kenyans, not individual benefit. Look at it collectively, a collective benefit. And therefore, it behoves every Kenyan to come out and ask themselves, what is it that I must do to ensure that this directive that has been issued today is fully enforced?
All right, let's bring up another question for Kano.
And my question is the government planning to increase the testing capacity in terms of the areas that have been regarded as the prevalent, so that at the end of 21 days that restrictions will be able to reduce the number of cases that are spreading around the country?
Kano?
Yeah, thank you very much for that question. Of course, you'd recall that when we started, you know, when this disease eventually got here, we were initially taking samples to South Africa. And then we increasingly, upscaled our capability and our capacity. We expanded our testing capacity, not just in terms of, physical infrastructure, that's laboratories, but also in terms of getting kits to be able to do the testing here. Right now, we are testing, conducting testing in Kisumu. We are also opening up testing in Kericho. We will be opening testing facilities in Busia. We are testing here in Nairobi. We have got NIC, we have got KEMRI, we have got CDC. We also testing in Mombasa, and also testing going on in Kilifi. There is also Lancet and Aga Khan as well, and others are being upgraded to be able to undertake the test. Those are facilities that previously were not testing for COVID. So within a period of 2 months, we've been able to enhance our testing capability and capacity to a level now that we can be able to test over 500 people in a 24-hour period. That's a big step forward. Now, with regard to whether we are able to test people, mass testing, across counties, that may not be necessary as of now. You do recall that there are counties that are already carrying out random screening that help in determining who may require to undergo further tests. So, as a government, as national government, we really want to thank those counties that have taken this up and are carrying out tests within their county borders. Sorry, not tests, but random screening within their county borders. That really does help, because if all of us are going to go for testing of COVID, we are going to really overwhelm our testing capacity.
All right, let's bring up another question for Kano.
My name is Enoch. My question to the Kano is, how is the collaboration between the county governments and the national government in fighting this COVID? For example, has the national government agreed on the methods of procuring some of these PPEs to county governments? Because governors are complaining on procurement restrictions.
Kano?
The relationship between the county government and the national government,
yes, especially on the procurement,
cannot be any better than it is. The national government and county government are working very, very closely. You realize that, when we get serious community infection, for instance, those that are within those community regions will have to be admitted either, within county level 5 hospitals or level 4 hospitals or certain designated quarantine facilities within the counties. And right now, the counties are looking at, operationalizing certain institutions to be able to make them ready in the event that we get serious community infections. So there is very close working relationship between national government and county government. In as far as the procurement of PPEs are concerned, and even training, not just procurement of PPE, but even training, that's actually being done by a national government, and these PPEs are being distributed to county levels. And in addition to that, also the national government has organized for training of trainers for the county medical staff. Now, the training of trainers, therefore, is aimed at ensuring that up to the grassroots level, everybody is able to understand what they need to do in the event that they come across a COVID case. At the grassroots level, whom do we have there? We're going to have, a community health volunteers, and they'll be given, training by those already been trained, courtesy of the national government. And therefore, in overall, the working relationship between county government and national government is very, very cordial.
Colonel, Faith Wasonga here says, if one needs to go for dialysis in Nairobi and they're outside of Nairobi, will that person be allowed in? Aren't we essentially sentencing our people to death?
We are not doing that. Most of the level 5 hospitals are able to provide that kind of, support. So most of, if you look at the 47 counties, majority of them are able to provide that kind of support. And therefore, really, unless, there is a serious reason as to why that kind of service cannot be offered. Indeed, to the best of my knowledge, is that we have been able to upgrade, our facilities within counties to a point that they're able to provide that support.
All right, let's bring up another question for Colonel.
I'm asking about the locking of the coastal strip counties and the Nairobi metropolitan. But then there is free movement of people within these counties. Don't you see that there's going to be spreading of this virus within just the locked regions? And then we end up having a Kenya without Nairobians and the coastal people.
What would be a lesser evil, really, to have people move across the entire country or to lock people within a certain designated region like Nairobi and the coastal strip, and then any infection that come are dealt with there, are contained there, and they are able to, to be addressed there. Indeed, you are probably, referring to a complete lockdown, whereby people are not moving out of their houses, and if they have to move out, they have to move out within designated time periods. Remember, we must allow production to go on. And if you look even at our infection rate, they are not to a level that would call for a complete lockdown of these regions. We need to go out and work and be able to make the economy to grow. If it gets to a point whereby now there are eruptions everywhere within those estates, then that may perhaps be necessary, a complete lockdown. However, that is a decision that will only be arrived at based on analysis and evaluations of how things are progressing. And that will be done by the National Emergency Response Committee, not one individual. Let's not pray for this lockdown, indeed, really. Let's not, push for it, because its consequences, are not necessarily what we want, to experience. Let's pray that our people are able to obey instructions that have been issued by the government, that our people are able to practice, measures that have been put forward on simple things. They are very basic things. They're very easy things to do, but they're nonetheless very effective. Simply wash your hands using soap for 20 seconds. How much effort would that require from an individual, right? Maintain 1 meter social distancing between you and another person. It does not require any effort. All it requires is just somebody to be rational about the fact that this is my health. It is my number one responsibility as an individual, really. If we do not do that, if we do not necessarily obey what the government is doing, even within Nairobi town, then we may end up to a situation that we would not want as a country to get into.
All right, Colonel, I'll give you a chance for final words to Kenyans who are watching you tonight. What do you want them to hear?
Mine really is very simple. Really, listen to the government. There is nothing the government would be saying, would be instituting that is not for the benefit of the people of this country. We are asking all our people, please stay home if you are able to stay home and work from home. If you're not able to stay home because of one reason or another, maintain social distancing. It is simple as that. And also remember to wash your hands using soap and running clean water for not less than 20 seconds. It's as simple as that. Those who are in matatu, kindly obey those instructions. Those who are using boda boda, the mushkaki style, please stop the mushkaki style. Let a boda boda have only one passenger. That applies to tuk-tuk as well. If we do that, then we are going to flatten our curve within no time. Thank you.
All right, Colonel Cyrus Oguna, the government spokesperson. Thank you so much for making time for us this evening. That's where we leave it for now. We're taking a quick break here on the Monday Report. There's so many questions that came through. I believe Colonel answered most of them. When we come back, we're getting into the sporting action. See you in just a bit.